The point I think that is also helpful to understand about ADHD and all of the things that we've talked about. ADHD is an ego-syntonic disorder. That means that it feels normal to me. It does not bother me. Anxiety, depression, these are what we call ego-dystonic disorders. So anxiety, when I'm having a panic attack, that feels bad. I'm going to go get help for that. I don't like the way that feels. Or when I'm depressed and I can't do my job, that feels horrible. I want to go get help for that. It's an ego-dystonic disorder. ADHD is an ego-syntonic disorder. This is my operating system. This is the way that I go through the world. I don't have a problem. All of y'all have a problem.
Yes.
Right? You people getting hung up on time, like that's your deal.
Welcome to Insights from the Couch. If you have ADHD or someone in your family has ADHD, or even maybe you're worried that you might have ADHD and you don't really know where to begin or if it fits for you, you are going to love today's episode because we have this amazingly talented specialist with us here today, Dr. Brady Bradshaw, who is dual board certified in adult psychiatry and adolescent and child psychiatry, and specializes in working with patients in both diagnosing and treating patients with neurodivergence, including autism spectrum disorder and ADHD. So first of all, Dr. Bradshaw, welcome, and thank you so much for being here with us.
Thank you for having me.
Yes, thank you.
Yeah.
This is going to be so great for our audience, and we're going to really dive into, in particular, some of what women need to know, because ADHD may show up a little differently in women, and it seems, at least anecdotally, that it's often underdiagnosed. So before we dive in, maybe we could start out just by asking you, what drew you to this specialty?
This is a topic that's so dear to me, and I can talk for a long time about it because it is so interesting to me. I always loved working with ADHD kids during my training. Like they were just the kids that I enjoyed so much. They had so much energy. They were so impulsive. And I think looking back, I just resonated with how they presented and how they felt. And I just felt a really deep empathy for them that I could understand their struggles. I actually have been diagnosed with ADHD in adulthood in my 30s. And I think that my story is similar to many women who get diagnosed with adult ADHD. I was looking for my son at the symptoms, and I'm a child psychiatrist. I diagnose ADHD all the time, and I still didn't see it in myself. But I was looking for my son, which is what I hear from a lot of my adult female patients, that they start researching for one of their children that they think might have some symptoms, or a teacher might bring it to their attention. And then they start realizing, shoot, like I have that struggle too. I have that problem too. Or I struggle with time management or transitioning attention, some of those like key symptoms. And then that brings them in to get diagnosed. And that's what happened to me. I was looking for symptoms that I was seeing in my son, started listening to different experts about ADHD, and it just really resonated. And so I scheduled I didn't want to, treat myself. So
Right.
or diagnose myself. So I scheduled my own appointment and got evaluated and diagnosed.
Well, thanks for sharing your
Yeah.
experience with us. That's
Yeah,
really
sure.
helpful to know.
Yeah.
And I know I've heard a lot of clients say something similar.
Yeah. I think it's really relevant. Psychiatrists, we don't tend to disclose a lot about our personal lives and histories, but I've heard this said, and I agree with it. I do think that having a therapist or a provider who has ADHD really helps to understand patients who have ADHD in their experience. So I do think it gives me a special understanding for what people are experiencing, or some version of it.
Are you open with that with patients? I'm just curious.
Some of them I am.
Yeah.
Some of them I am. Again, I think the traditional psychiatrist stance is it's really your time. It's not about me. And so I don't really share. If they ask me point blank, I'm honest about it. And some of them, some really bright ones are like, clearly this is also something you struggle with. I have coffee
Yeah.
on my shirt, or I'm running 5 minutes late, those things.
Right. That's great, though, to be relatable.
Yeah.
How did that change your life? And did it have a huge impact to get diagnosed in your 30s?
Well, honestly, it was like this huge opening for me internally because so much of the symptoms of ADHD have a moral judgment associated with them. So, it's common for people with ADHD, as an example, to be time blind. So they might run late or they might
Yeah.
misjudge how much time it would take to get them places. Our society says, well, if it really mattered to you, you would be on time, or if I was really important to you, you would be there on time. And that truly isn't the case for people with ADHD. They know it's important to be on time. That person does matter to them. It's really such a biological, organic struggle that takes a lot of effort. And some people can sort of white knuckle effort, modify and make behavioral changes, but it still is a challenge and takes more work to accommodate than someone who doesn't have ADHD. So for me, it was like looking back at my life and being like, wow, all of those things weren't really quite the reason and didn't really mean that. I was just told that's what they meant, but it actually was something else that I was struggling with that no one was recognizing. So it opened up a lot. I think I had a lot more grace for myself and empathy for myself. As a child psychiatrist, I'm really all about modeling for my children. It allowed me to start modeling for my kids. Shoot, I missed that appointment. I hate when that happens. I must have been thinking about something else that was really brilliant and I couldn't make it to that appointment. So
Uh,
starting to model for them the grace of that because they're going to have that experience too. And
Right.
so I don't want to beat myself up in front of them for things that they're going to struggle with most likely down the road. So
that is so interesting. I mean, just to disclose, I have 3 members of my family that have ADHD, one of them being my husband. And I do see that, like, you're always up against a lifetime of that kind of shame that gets accrued around a lot of this stuff, especially from school and little boys and school performance. So a lot of that, like, defended stuff comes up of, like, but you're right, having some grace for yourself can be really hard.
Dr. Becky, who wrote Good Inside, talks
Yeah.
about how she calls them deeply feeling kids, which is another way I think of saying neurodivergence, but how they're and we can talk through some of this, the emotional dysregulation that can come with ADHD,
Yes.
that their emotions sit so close to their shame that when they are dysregulated or they are having big feelings, it's very quick to go to shame.
Love her, by the way. I just listened to her on the
Yeah.
Huberman podcast, and it was excellent. For anybody listening, I highly recommend anything by
Yeah.
her.
Maybe you could give us a little distillation of what is actually happening in the brain, because I have had so many spouses who just don't really think that there's something really happening that can't be overcome. And I think you're making an excellent point. If I mattered to you, if I were a priority, that's what I hear all day in couples therapy. So, can you explain just a little of what's going on in the brain that makes this so different?
This is it's a really good question and it's complicated. There is an opening and we are starting to diagnose women more and especially adults with ADHD, but we still follow the DSM criteria for diagnostics, even though it seems that it kind of seems like more people are getting diagnosed. We're really just kind of catching up and realizing that the symptoms might look differently. But we're
Interesting.
still using the DSM criteria to diagnose these adults and women or females with ADHD. So you're looking for 6 symptoms in the inattentive list or 6 symptoms in the hyperactivity impulsivity list. And there needs to be, because it's a neurodevelopmental disorder, there needs to be symptoms prior to the age of 12. So when I'm diagnosing an adult, I am asking about some of their early childhood experiences.
Wow.
And we used to think that 50% of people outgrew ADHD. We now are kind of backpedaling on that and realizing that this is a neurobiological disorder that continues into adulthood. People figure out different accommodations to manage their symptoms, but probably most people continue to have ADHD. Russell Barkley and Ned Hallowell, these are like 2 of the big names in ADHD research. They both feel that the DSM criteria sort of do a disservice in terms of diagnosing and explaining what it's like to have ADHD. Russell Barkley talks about ADHD as a disorder of self-regulation. And I actually think that that's probably the best description of ADHD because it captures the fact that ADHD affects all aspects of life. So it's not just, I can't pay attention in school or I'm a behavior problem in school. It's everything that gets affected by this difficulty in regulating the self. So that can apply to emotional regulation. So people with ADHD can have 10 out of 10 feelings, over small things, seemingly small things. So they can get really emotionally dysregulated. They can struggle with transition of attention. So they can have a lot of attention and be totally hyper focused on something, or a lack of attention. So it's trying to find that middle ground for them that is really, really challenging. The time blindness is sort of a separate issue, I think. It probably has something to do with some of what we understand about ADHD, which is that their frontal lobes and their prefrontal cortex, the brakes of the brain is what Ned Hallowell calls it, are not as effective or not as strong. So
Gotcha.
they're more impulsive. And that is where time is thought about. The lower parts of the brain don't track time. And we know this from trauma research, right? That if you get
Right.
triggered, it's like it's happening now, not when I
Right.
was 5. So it's probably related to that the frontal lobes and the parts of the brain that track time aren't as online as maybe they are for someone who doesn't have ADHD. And then
Right.
dopamine is the other big player for ADHD. So do you want me to keep going?
Yeah, I
Yeah.
want to hear about the dopamine
Yeah.
piece.
Tell us about the
The
dopamine.
dopamine.
Who doesn't want some of that?
Who wants a dopamine? So the theory is that there's a deficit of dopamine in people who have ADHD. So things that maybe, dopamine is related to the reward systems in the brain.
Right.
So dopamine is like making a big purchase, or having a really good meal or winning an award. It's like this rewarding feeling that we all naturally can have. And the thought is that people with ADHD maybe need more of those feelings to get that same reward type of feeling. And
Gotcha.
that they're constantly looking for dopamine because they're running at a deficit. So they might look at food for reward. They might look at alcohol. They might look at shopping. So that can lead to some of those compulsive behaviors
Yeah.
for that reward gratification.
My experience with some of the people in my family is like working memory seems to be very can be impaired.
Yes.
I watch my husband move through the house and put things down and have no sense of how to unwind that. And so then, he has no idea that he was in the laundry room 5 minutes ago and then the bedroom. So he'll toss the whole house. You can just tell there's no working memory there, or it's muted.
We see that in neuropsychological testing. So when people have neuropsychological testing done, which is like IQ testing basically from a psychologist, one of the things that they're measuring is short-term memory or working memory. So that's the memory that you hold on to for a little bit to get something done. So maybe it's, reading the first 2 steps of a recipe and going to the kitchen and getting the ingredients and the tools that you need to then move on with the recipe. People with ADHD, their working memory or short-term memory is really poor in general. And so unless it's something that they really care about or have a lot of feelings and are passionate about, it's like in one ear out the other. It's
Yeah.
really, really hard for them to hold that information. And we see that on the neuropsychological testing, that those are usually their lowest scores for neuropsych testing.
Fascinating. So the other piece that I hear a lot about is that little boys are overly diagnosed in childhood, that this has become a catch-all bucket for any little boy that can't sit still. And that little girls, we're missing a lot of that. So could you talk about how it shows up differently in,
Mhm.
as young kids between
Yeah.
these two genders?
The overdiagnosis point, I want to say, I think ADHD is both over and underdiagnosed. Most experts agree with that. The protective factors for ADHD are a high IQ. Uh, Also, if you have any anxiety, a little neurosis will like inhibit your impulses. So that's good. So if you're afraid, if you're deathly afraid of getting in trouble, that might help you control some of your behavior. It's not easy, but you might be able to. And then if you're a girl, all three of those are protective factors for ADHD. They have better prognosis. We talk about boys are more likely to have externalizing symptoms, and girls are more likely to have internalizing symptoms. So boys are more likely to get picked up because we can see that they're struggling with attention because they're talking to their friend, getting out of their seat, playing with some other kid instead of doing the worksheet, whatever. So it's much easier to see the behavior that is reflecting what their internal experience is, versus girls, things that are often said about them is they're daydreamy, they're in their own world. So they are quietly distracted and not necessarily causing behavior problems. They're more likely to be inattentive. Sometimes they will get in trouble for talking too much. So I ask my female patients who are adults, like, did you ever get in trouble for talking in class? And, a lot of them, yes. They also might do smaller behaviors like twirling hair, tapping foot, things that are less disruptive in the classroom. And for whatever reason, we are just sort of biased against diagnosing females. So even the girl who's inattentive and daydreamy, she might get labeled as anxiety versus ADHD. So there's
Right.
this bias in our culture to label as anxiety and not ADHD. I think the first study about ADHD in girls was like 2000 or something like that. So there's a big lag. This is true for autism as well.
So if I'm
Yeah.
a mom and I have a little girl who may have ADHD, is it just going to be really hard to figure that out?
Potentially, yes. I think it's really important when I have a parent who's concerned, or an adult patient who's concerned. When it comes to ADHD or autism, I always want to hear as much as possible about what their experience is, because there's your experience and then there's the compensating behavior. And
Right.
so I'm less interested in like how you look to other people. I'm more interested in like, what is it like for you to be able to look that way to other people?
Okay,
Yeah.
because some people may be able to pull it together and compensate better than others, but their
Exactly.
internal experience may be fraught
Absolutely.
with a lot of effort.
So if you were that mother, I would say to advocate for your child and get a good evaluation. I mean, when I'm evaluating a child, it's like a 2-hour evaluation at least. And I might then see them again for another hour to really get the information that I need. It can be really challenging. I wanted to also mention, I'm glad that you brought this up. People think that testing is required for an ADHD diagnosis, and it's not.
Wow.
It's a clinical diagnosis. So that means it's based on the history that the patient is giving you. We
Okay.
do get collateral often for ADHD, so I might try to talk to a teacher, see what's happening in school or peers or, other areas of their life, because again, the DSM criteria is we're trying to see it in more than one setting. It should be pervasive, but it really is based on the clinical evaluation. So this idea that you can test for ADHD is actually wrong. There is,
Interesting.
psychologists will do testing, which is IQ testing or learning disorder testing, which is helpful. And the patient may have short-term memory deficits that might show up on testing. But a very intelligent, anxious girl can white knuckle it through testing and not
Right.
necessarily show up as ADHD in the testing. That's the whole point.
I'm so
Right.
glad you mentioned anxiety because I, for one, always get a little lost in like the Venn diagram between like ADHD and anxiety. And is that something you see a lot of? And I'm wondering, are like especially in girls that those things kind of dance together?
Mhm.
Or is there a way you like kind of tweeze that apart?
There is a lot of comorbidity. I think it's like 40 to 50% of females with ADHD have comorbid anxiety. So you can have both.
Mhm.
Um, where I try to tease it out, at least, in teenagers and adult females, is the anxiety that I hear about in my ADHD patients is in forgetting or missing appointments or forgetting or missing things that need to be done, or the to-do list is so long and I don't know if I'm going to be able to get it all done, or I have all of these things running around in my head that I need to do and I just don't know if I'm going to be able to do it all and I might forget, my son's lunch or, so um it's the anxiety is really specific to the struggles with executive functioning. And we
Interesting.
can talk about executive functioning, but the anxiety that goes with the ADHD woman that's more ADHD rooted, I find tends to be associated with their struggles with executive functioning versus like a generalized anxiety disorder where I'm worried that, my kid might get bullied at school. And then I'm also like worried that, a hurricane might come to my house or, it's like these
Yeah.
fears that
Mm.
people ruminate on and kind of keep them up at night. That feels to me diagnostically different than someone who's worried that their to-do list is too long and they're not going to be able to get it all done, you know.
So the anxiety often with ADHD is related to anxiety about the ADHD and the ability to perform those executive functioning duties,
Yeah. Yeah.
stress related to that. That makes a lot of sense.
Yeah. Where my brain goes next, because I hear a lot about this term like rejection sensitive dysphoria
Yeah.
that goes along with like ADHD, which is like the emotional processing of like where negative emotions seem to come in at you in a stronger way. Do you see this as well? And is this like a neurodivergent thing, an ADHD thing? Does it cross over into autism? I'm just curious on that point.
And maybe we can explain a little bit
Yeah.
about what that means.
Yeah. Rejection sensitive dysphoria.
RSD or rejection sensitivity dysphoria, it's not a DSM criteria. It is something that we see associated with ADHD specifically. I don't believe it's as associated with ASD, though there's a huge overlap between ASD and ADHD, right?
Yeah.
So I think it's like 70%. That might be high, but maybe 60 to
Wow.
70% of ASD and
Wow.
also have ADHD. So there's a huge overlap, and I think that sometimes is confusing, like on TikTok. You see someone's like talking about their ASD, they sometimes will mix in there like ADHD symptoms
Yeah.
because there is such a huge overlap. But RSD, another acronym, I think the numbers are something like 90% of people with ADHD will resonate or endorse symptoms of rejection sensitivity dysphoria. How that looks or how my patients will describe that is any perceived negative feedback from a peer, from a parent, from a coach, it is like soul crushing. They even will describe it as like physically uncomfortable
Yeah.
and like distressful. So I think it's important to understand that because if you're thinking about attachment, and how important that is relationally. If you have someone who feels completely shut down by a negative comment from someone else, that's significant, And so, probably the best case scenario is if the person with ADHD recognizes that they have that tendency to then sort of, or that insight to talk to themselves about it. Like, I know that Jenny's my friend, even if she said one negative thing to me,
Right.
maybe
Talk
she
your
was
way
having
through it.
exactly. Maybe she was having a bad day. I know that this doesn't destroy our friendship. I
Right.
can, and try to sort of rationalize. But I think the challenge with people with ADHD, because they can get so emotionally dysregulated, it can feel like I said, just soul crushing. Like Jenny hates me. I know she hates me. She hates me.
as
Yeah.
I'm listening to you, and I think this is probably a very common thing that people experience, potentially even who don't have ADHD as well. But so is it just that it's so painful to feel that rejected experience? Let's say it's not even such a huge statement, but it's something small, like, I didn't really like the way you made dinner. I don't know, that's a bad example, but you know what I'm saying? Something that's not fundamental to the person, that
Mhm.
that person might experience a feeling of rejection more deeply and intensely than somebody else. But is it also that their thoughts then become very absolute and black and white and they extrapolate meaning that's pretty rigid? Is it both of those components typically?
Yeah, it
Okay.
is, and it's such a Ned Hallowell talks about ADHD as like a disorder of opposites because people with ADHD say things impulsively that hurt people's feelings. So
Right.
it's like this paradox. It's like, but you do that. So like, how do you not know that like other people might say things that don't mean that? So it is. It's felt so intensely, and that's the part of the dysregulation. So it really is felt so strongly that they're in, if you take a DBT perspective, they're in their emotion mind. They aren't, that rational part of them is not online. So
Right.
it's all emotion. It is black and white. This feels so horrible. This person never liked me. They
Yeah.
hated me all along. And it was just a matter of time before it came out. It can almost sound a little paranoid.
Yeah.
And,
Yeah.
and where I see it for kids is the teacher will yell at another student and
Mhm.
they are like shut down. It is like
Wow.
just like they can't even tolerate being in the class just about. I mean, it can be like very, very intense.
So
Yeah.
from feedback that's not even necessarily directed toward them, just even seeing that experience happen to someone near you and knowing that that could happen to me if I did or said the wrong thing shuts them down.
Or over empathizing with the student. Like, oh my God, like if that must feel so horrible. Like,
Yeah.
they can
Yeah.
almost Dr. Becky talks about these kids as being really porous, and I believe that's true. They're super sensors. So it's like they can be in the other person's shoes like entirely. They can over empathize with people.
Yeah. See, I really relate to that personally, just really being, I feel like a conduit to what other people are feeling, and maybe even too easily being able to put myself in someone else's shoes. So, this
Mhm.
brings me to another question, which is, if you're a woman, let's say in your 40s or 50s, and you've never been diagnosed with ADHD, but you wonder about it from time to time, what might you be experiencing that could be good markers or clues that it might be worth it to go talk with a psychiatrist and get an evaluation?
With women, I think it's complicated by hormones, of course. This is for
Mm.
everything, right? So there's another
Everything.
factor at play that's exacerbating symptoms. So there's like these watersheds of like when women may get diagnosed with ADHD, and it's usually after big hormonal shifts. So puberty is a time when girls start to get diagnosed, middle school age, childbirth, after childbirth, and then perimenopausal or postmenopausal. So I see it as like these big step downs almost, where
Mm.
you start to see symptoms coming through. A woman in her 40s or 50s may be starting to have some perimenopausal symptoms.
Right.
So short-term memory is like, I think, a flag. They'll come in saying, I think I might have early dementia. I can't remember anything. I
Mm.
hear that often. That's a big one. Sleep disruptions also can be sort of like a flag. Um, Going to the hormonal piece for a second, because I think it really is pertinent to women and ADHD. We know that estrogen basically is protective for ADHD. So I even see variations in women in their cycle and their symptoms.
Wow.
So as their estrogen goes down during their cycle, their ADHD symptoms go up.
So interesting.
Yeah,
Yeah.
yeah, and it can get to the point, like, right around their period where they're, like, barely functioning, and if they're taking medication, we haven't changed the medication is the same, and they just feel like it's not working anymore. So it's pretty dramatic, and then progesterone is the hormone that's really connected to good sleep. And so that's like another flag, I think, for women in their 40s and 50s that sort of can sometimes bring them in to see me, is their sleep starts to get really disrupted from the
Right.
progesterone changes and shifts. Those are things, sleep, short-term memory, that maybe you might want to think about getting evaluated, and either, for hormone replacement, if that's applicable and healthy for you, or, for ADHD that maybe wasn't recognized until now.
Is it then that some of the symptoms that can go just with perimenopause or menopause can also overlap and be missed markers of ADHD?
Yeah, it's a lot of overlap, and I think there's a lot more research coming out regarding perimenopause and menopause
Yeah.
that we're getting more
Thank
information.
God,
We're
right?
also I know. I feel like we're also on, like, the leading edge of that. Like, there still
Yeah.
needs to be a lot more to be able to really understand the overlap of those two things, ADHD and perimenopause.
So interesting. I mean, I'm 50 and I just started taking progesterone. My endocrinologist suggested it. I have Hashimoto thyroid disorder, which is also very common in women my age.
Mhm.
And I developed it in my early 40s, or at least became aware of it in my early 40s, the Hashimoto. And my endocrinologist just suggested that I start doing this hormone replacement. And,
Mhm.
it's so interesting. I don't think people realize until we get to this phase of life that perimenopause itself can last for, 10 plus years,
Mhm.
those
Mhm.
symptoms.
Yep. Yeah.
Yeah, and it's also like an increased risk in anxiety disorders for all these inflection points and hormonal shifts, right? I mean, I
Right.
know rates of OCD can really spike at these hormonal shifts. It's something that we don't talk about, depression as well, right?
Anxiety and depression, absolutely. And we know this in psychiatry. We know that there's a connection between hormones and psychiatric disorders or psychiatric diagnoses. I think where psychiatry still has so much work to do is, what do we do about it?
So what do we do about it? Like, I mean, what is the standard treatment for the average person? I mean, obviously this is also bio individual and case by case basis, but what is the standard kind of care for people who come in and get an, ADHD diagnosis?
The ideal case, in my opinion, is when I have a primary care doctor, an OBGYN, an endocrinologist who's like, okay, let's work together, me and you the psychiatrist, me the PCP, and let's figure out a plan. I'll start working on the hormones. You start working on this, the mental health or psychiatric symptoms. And let's work together to kind of see, like, the least amount of medication in this case that we're talking about that we might need to try to manage the symptoms. So when they go hand in hand, that's really the ideal case scenario. The studies that they've done in the mental health field where they try to treat women with only hormones for these different diagnoses are not successful. So they don't show
Mm.
that they're very helpful. I think that that's probably related to just struggles in general with diagnostics in psychiatry because we use the DSM and it's just based on symptoms. And maybe women who have a hormonal or a hormonally driven depression aren't the same as women who have depression unrelated to hormones, but they get
Right.
grouped in the same study. So I think it's ideal when you can work as a physician, it's ideal when I can work as a team with someone that's in their specialty and I'm in mine and we can work together. What can happen sometimes is the other specialty they'll prompt back and forth, and that doesn't feel good to a patient when the primary says, "This is a psych issue, go see the psychiatrist."
Right.
That doesn't feel
Right.
good. Yeah.
So what about medication? Is it true that most people with ADHD will do better taking medication?
Medication is considered to be the primary intervention for ADHD. And I always tell my patients, especially in child psychiatry, any other diagnosis I'm making, I'm sending you to therapy, anxiety, depression, PTSD, therapy is first line for children and adolescents. But ADHD is really, it's a neurobiological disorder. It really has to do with the neurotransmitters in your brain not working the same way that people who
Right.
don't have ADHD have their brains working. So medication can be very helpful. Stimulants are the traditional, first line treatment, and those
Right.
medications increase dopamine. So they help to kind of bridge the gap that is the deficit of dopamine in the brain. The efficacy rates for stimulant medications for ADHD are between 80 and 90%.
Wow.
So it's staggering. Yeah, compared to like an antidepressant that's like, barely above placebo sometimes, it's like a
Wow.
40% effect rate. So it's one of the most rewarding things to treat because you take the medicine and you immediately can see a benefit. So there is a role for potentially coaching, ADHD coaching. I think that can be very helpful to start to learn where your executive functioning deficits are and what are some strategies that work for you. And I think there's a big role for therapy, especially in women with the emotional dysregulation that can come
Yeah.
with ADHD. That can be very helped with therapy in a way that I think is more helpful than medication.
I love that we're talking about the emotional dysregulation piece because I just know that most people do not associate ADHD with emotional dysregulation. It's always a crisis of attention and focus, but that is such a huge piece of it.
It really
And
is. Hearing you say that, I know you're right, and it breaks my heart because
Yeah.
it's almost to me even more, as from a psychological perspective, that's even more important to me to help your child with their emotion regulation than if they get a C or a B in school, like that is such a big important piece of this.
Oh, yeah, I know. I see that with my family member who has ADHD and another child who doesn't, being not always so sensitive to that.
Mhm,
What's with her and she can't get it together emotionally. And,
mhm.
that breaks my heart because it's not as easy for somebody to regulate if they're struggling with those other factors.
does medication also begin to stabilize that piece as well, that you can make a lot of progress with the combination of like medication and therapy around the emotional regulation piece? Or
Yeah.
is it because you've like stabilized focus and executive functioning that that piece has an opportunity to come online a little bit?
I think it's both. I think it's both, and I think it depends on who we're talking about, if you're talking about a child that's melting at the end of the day, so having like huge explosive outbursts, tantruming, super dysregulated emotionally at the end of a school day, I like to think about if they're unmedicated and they have ADHD, during the day in the classroom, all day, they are working so hard to try to control their impulses, control their behavior, focus on something that's not interesting to them, do the work, write it nicely. A lot of them have struggles with fine motor. Like the amount of effort that's being put into their long 8-hour day where they're sitting all day, especially if they have hyperactivity, that's so hard, and then they're having these huge emotional outbursts at the end of the day. It's like, of course they are. Of course they are.
Yeah.
So if you medicate that child and help them with their ADHD symptoms during the day, then yes, I think there could be less of those meltdowns at the end of the day. I think the same is true for adults, but maybe it looks a little bit different. If my day isn't requiring 110% of me, I'm going to have more left at the end of the day to give to my kids, to give to my husband, whatever, that I can be more patient and less dysregulated, less reactive if it didn't take all of me just to get through my day.
Are there certain people that just can't tolerate stimulant medications?
We think it's about maybe 5 to 10%, but I also see that if medication is rushed, or if it's, titrated too high too quickly, or started on like a 12-hour med and you've never taken a medication, that is often going to lead to side effects. So when we start with too high of doses or like this, big gun stimulant, like, and you've never taken medication before, that can be the problem. I think if, child psychiatrists, we always start like really low and with something really short acting just to test the water and see. So I think probably some of the people that you hear saying, I just can't tolerate it, I'm curious, like, what have you tried? What did you take? And is there a way to make it smaller to see if you could get some benefit from it?
Hmm.
Right. And what would you say to a patient, Brady, who might be worried about the safety of taking these medications? And some people are so afraid, oh, I don't want that, and it can be so helpful. So how do you typically answer that for someone?
Well, the data on that is very, very clear because these medications have been around for a really long time. The data shows that they're very safe in general and really have minimal side effects. Again, unfortunately, for whatever reason, our culture is so sensitive to
Yes.
side effects, and I wonder if maybe it's because it's in our children, and so we're all like very sensitive to our children, and not wanting our children to be over medicated and their personalities change, all of these fears I hear about. That is usually if a child is over medicated or an adult is over medicated. So starting really low,
Yeah.
starting really slow is helpful. The most common side effect is a decrease in appetite, and there are ways to work around that. But in general, these medications are really, really safe. And I also reassure adults, patients who are taking it, and parents, we can stop it at any time, and you will
Right.
be right back here. You know, you're not marrying it. It's just a trial. So if
Right.
you hate
Yeah.
it, you stop it and they're done. You're right back to where you started. There's
Right.
no permanent change that's being done by the medication.
I love that. So it's
Yeah.
safe and it's effective. And I just know as a therapist, I have seen people for a long time who have this mental meaning structure around medication, fear-based or just an idea of what it means to take medication, and they fight it and they fight it and they fight it. And then eventually, finally, they give it a shot. And I hear almost across the board, oh my God, I wish I had done this sooner.
Yeah. When
I
it
know.
works, it works.
I'm always really sensitive to that, and
Yeah.
definitely explore with the patient, like, what is the fear, and respect, if you don't want to take it, that is okay. This is totally
Right.
your choice.
Right. It's
Um,
your life.
I'm just here to provide you the information. You're in charge of making the decision. But the point I think that is also helpful to understand about ADHD and all of the things that we've talked about. ADHD is an ego-syntonic disorder.
Mm.
So that means that it feels normal to me. It does not bother me. Anxiety, depression, these are what we call ego dystonic disorders. So anxiety, when I'm having a panic attack, that feels bad. I'm going to go get help for that. I don't like the way that feels. Or when I'm depressed and I can't do my job, that feels horrible. I want to go get help for that. It's an ego dystonic disorder. ADHD is an ego syntonic disorder. This is my operating system. This is the way that I go through the world. I don't have a problem. All of y'all have a problem.
Yes.
Right.
You people getting hung up on time, like, that's your deal.
Ah,
Another way that I like to say that to teenagers, especially, it's like you're a Mac in a Windows world. Your operating system is your operating system. It still gets things done. It's a different way, but the problem is that we're in a Windows world. So there is a structure in our world that is set up for people who don't have ADHD, and we're trying to convert all the time. We're trying to
mm.
get you over here to this Windows way of working. So I think that can feel really validating for people with
Yeah.
ADHD, that it's your operating system. So it's okay, but where you're having some issues, maybe we can help you with that, like paying bills late or blowing up your relationship, or
Right.
wherever it's showing up, those ripples that are giving you problems, we can help with. But it, I think that's one of the challenges for women to get diagnosed, because they can be like, It
I don't have a
feels like
problem.
that. And everyone around them's like, you definitely have that, you know?
Right. I'm just a great Mac. And it's a great
Yeah.
analogy because I'm like, wait, we're not living in an Apple world. I'm living in an Apple world. Microsoft, right? But that's really how it feels, right? If that's your thing and that's your operating system and that's your world, it doesn't feel like this thing is happening to me and I have to get rid of it and I have to fix it and figure it out like extreme anxiety or depression. It just feels like this is who I am and how I move through the world.
Mhm, mhm.
And to
And
that
I
point,
think
do most people get brought in by like a spouse, or are they getting tapped on the shoulder to be like, come on, deal with yourself? As
yes.
opposed to, yeah,
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 Yeah.
it's usually a spouse that I'll get, the patient will tell me, my wife thinks or my husband thinks. Or it can be painful consequences,
yeah.
like
Yeah.
Job
forgetting to pay
loss. Yeah.
bills, a job loss, or losing their patience with their children,
Yeah.
getting dysregulated with their child, or feeling like secondary effects, feeling like a failure. I never remember when it's like mom's day at school. I like had it on my calendar wrong. So it's like
Mm.
those mistakes that start to feel bad, that will bring people to treatment. Yeah.
So, and
Yeah.
then I think it's great going back to what you said at the beginning, really having grace for yourself with those things, understanding that there are differences in the way your brain is working that are contributing. You're not to blame, not being hard on yourself, but maybe being open to evaluating and seeing if this is playing a factor. You don't need a test. You don't have to take medication if you don't want to. But it's possible and very probable that there are a lot of people listening right now who may have ADHD and just never have known that. And they're just moving through life thinking, this is my operating system. And it's possible that with a diagnosis, there's so much more resource and help available to you that can really enhance the quality of your life.
There's so many like behavioral hacks that can be helpful that, like you said, even if you don't take medication, you can learn about. There's so many resources now out there on YouTube, TikTok, all these platforms that might really work for you. One of the funniest and best things I've heard about behavioral hacks is some of the tricks work for some of the people some of the time,
Yeah.
So like
Yeah. Do
you
you
can
have a
try.
favorite trick, like a favorite behavioral hack you could
Mm.
share?
I have a couple. I mean, one for me is not trusting my brain to remember something. Like I
Yeah.
think like I'm going to remember that. This is really important. I'm totally going to remember that. And then I don't. So I don't trust myself to remember things. So I write everything down. I have all kinds of apps. I have sticky notes all over my house. I've got whiteboards everywhere and it's like just get it out. Another like saying is that the ADHD brain is an idea generator, not an idea container. So getting
Right.
all of that
Mm.
out of my brain and writing it down so I don't forget, is really one of the things that's been most helpful to me.
I love that.
Yeah. And I mean, we could have you on for hours because I am so curious about like even the uptick in like neurodivergence across the board. Because I know rates of like ASD have gone way, way up. And some of that's our sensitivity and diagnosis, but some of it's just the prevalence is going up. So I'd love to talk more about that at another point, but this is in the same realm. So I'm so glad we talked about it today.
Me too.
Thank you so much. This is
Yeah.
so helpful. I learned so much and
So did I.
we're therapists, we're in mental health. So it just shows you how much there is to learn, right? If there's so much that we don't even know and we're both in families dealing with ADHD, I just think everybody will benefit from this information and more to really get more and more educated about understanding, this is a real thing. And it doesn't have to ruin your life. It's just about understanding it. Thank you so much, Dr.
you.
Bradshaw.
Oh, my pleasure.